Our topic today is laser use in a modern dental practice. And we're going to specifically talk about the diode laser. And I again thank DenMat for sponsoring our program tonight. This is an instrument, you can see it, I'm holding it in my hand, that's about the size of a Sharpie. And we find that it's very, very effective, making me more efficient and proficient in my practice. And I think that's what we're all going to need to do when we get back to work. Well, Michigan's gone through a lot of changes. We're one of the hard hits areas, but this is beautiful northern Michigan. It's a beautiful state, and hopefully soon we'll be able to enjoy our families and recreation sometimes very, very, very soon in the very near future. So let's ask a question. Let's begin. How do you manage soft tissue in your practice now? You know, how do we, if we prepare a tooth, I'm assuming, I'm going to make an educated judgment that most of us prepare slightly or at the gingival level. We use retraction cord, a 0 cord, or a 0-0 cord, and in a 1 cord to get retraction of the tissue. We know that we have to anesthetize the patient, most of our patients, to be able to perform this procedure. We use a scalpel to incise, to do our biopsies, to do our frenectomies. But a third option that I'm going to present today is the use of the DenMat NV Pro 3 diode laser. And you can see this is a very, very portable unit that works very efficiently in my hands to do a number of things that we're going to demonstrate in the next hour today. And then as Lauren said, we'll have time for questions later. This laser is, we have several lasers in the practice, and this is my favorite by far. As a matter of fact, we had to purchase a second one because our hygienist has incorporated this diode laser into her treatment of patients to help in pocket elimination, pocket reduction, and helping in her scaling and root planing, and some other factors that we'll discuss in a few minutes. So our objectives today are going to be basic. Normally this is a full day program, and I know that Jennifer Archer at DenMat has some special programs available at the end of the program for you that I will discuss with you. If you're thinking of investing in this, some of the instruments that we're going to talk about today, I'm going to give you a site that you can link to directly. And if you decide to purchase, then they are offering a free CE program, and we'll meet face-to-face one day, and then we can do hands-on demonstration of the product, which I think is really, really helpful with this innovative tool. So we're going to just very briefly discuss the fundamentals of laser and the advantages and a lot of different clinical applications. We'll talk about the advantages of using this diode laser for tissue management, soft tissue management. Briefly, we'll talk about laser settings and adjustments, including modification and application for clinical parameters. Obviously, this is not a hands-on program, although I'm going to show a couple of really short videos demonstrating how we use it. But again, if you do decide to invest and save some money today, they are offering for you to come to one of our courses or any of the courses that are provided by DenMat. Many of you may remember DenMat when I was a young dentist as being one of the leaders in material products. And over the past years, it kind of changed a little bit. But with their new leadership, they are really an innovative company that is really trying to make a mark in dentistry. And their objective and their goals are to make us more proficient, efficient, and save us money in allowing us to have products that are really, really high-end, high quality at a fair price. We'll talk specifically about the procedures that I use this diode laser for. I use the diode laser every day in my practice, as do my hygienists. And we'll talk about insurance a little bit. So this is my Stephanie, who in the soft tissue management will use this in sites where we have bleeding, some pocket depths that are a little bit excessive, and we've seen some remarkable results that I'll demonstrate in a little bit. So what is laser? Light amplification by stimulated emission of radiation. It's light energy. And what does the laser do? It will allow us to cut. So we can incise, we can do frenectomies. It'll allow us to coagulate blood vessels if you have a bleeding area. It'll allow us to cauterize nerve endings. It'll allow us to sterilize wound edges. We have a very, very, very clean, healthy situation. Very little patient discomfort following the procedures. A lot of different lasers out there. We don't have time to go into all of this, but the NV Pro 3 laser is a diode of gallium, aluminum, and arsenic. It's very specific in the laser industry, and it is in the visible light range. And what that means is even though we are wearing glasses, the patient's wearing shielded glasses, and the staff is, it's not going to result in any radiation or any health issues. We just want to protect our eyes from the visible light. We have two settings with our laser: a continuous wave, which means that we have a pulse that is continuous, versus a pulse mode where we have an on and off, on and off, on and off type of setting. So we actually cut down the power level by half, and it will allow us to sometimes more comfortably treat the patient. We don't want to create a lot of heat energy for our patients, and that will create some discomfort, which will require anesthetic, whether it be topical or infiltration. But in most situations in my practice, we are able to use the laser without any significant anesthetic. I'm going to run through this a little quickly here. 4 things can happen to laser energy. Energy can be reflected, and that's why we have dark colored glasses when we're doing our procedures to protect our eyes. It can be transmitted. It can go deep into the tissue, which can cause damage or can cause discomfort. It can scatter, which is a process that we're going to refer to as biostimulation. We use it for angular cheilitis, for aphthous ulcers, for herpetic lesions in the mouth, where we don't even have to touch the lesion to get healing. And absorption, and that's where we're using it most frequently in the dentist's hands in tissue retraction. And that absorption will lead to cutting. So absorption, the diode laser, this particular diode laser is absorbed by hemoglobin or blood, melanin, skin, water, and pigmentation. So in the more bleeding, the more discolored or the darkening of the epithelium, the pigmentation of the epithelium will result in a more efficient cutting of the site. We can use this on pediatric. We can use it for frenectomies. And think about it for a second. You would think that you'd want an energy level lower when we're working on a young child, but actually if the pigmentation is lighter, you're going to want more energy to get the same results. The laser is only attracted to soft tissue and will not be absorbed by anything else. So you're not going to damage dentin or enamel on the tooth. So it's an instrument that, again, is a very, very important tool in my practice, something that I use every day. Thermal thresholds, if we get above 200 degrees Celsius, that's where we get carbonization or charring or blackening and discomfort with the patient. So what we want to do is to regulate our laser so that we're not getting that charring or carbonization of the tissue. The laser normally works in the 100 to 150 degrees Celsius range, which allows for tissue vaporization, and it's a very comfortable procedure. Again, I think our patients respond very well to it because, number one, it looks really high-tech. It doesn't look very intrusive to them. It looks like a Sharpie, and the results have been remarkable for our patients. An electrosurge, again, very high degree of temperature change, which results in blackening of the tissue, tissue resorption, and non-consistent healing of the tissue. So why do I use a laser? So clinical benefits, incremental revenue through additional procedures, hygiene procedures, biostimulation procedures. Again, if it's a time-saving device for you, again, doctors, you do a crown preparation, you anesthetize the patient. Let's say the tooth has a root canal, and we prepare the tooth, we anesthetize, we wait, we come back, and then we have to retract. We put 2 cords, we walk away for 5 minutes or so, 10 minutes, we come back, we make our impression. If we're able to do these procedures all in one step, even without anesthetizing the patient, that is a big time saving. And my thoughts, and Lauren's heard me say this before, time is money in my practice. My efficiency determines the revenue that I can create, the number of patients that I can see throughout the day. Patients are very acceptable, have a lot of acceptance with this particular laser because, again, it is very non-intrusive to them. When a patient has a positive result, for those of you who heard me before, a positive result with a patient, a happy patient, is going to refer other like patients into your practice. So it is a wonderful internal marketing tool that you can provide your patients. Put it on your Facebook page, put it on your website, etc. It makes my production more efficient. It allows me to see better. Doctors, you're doing a class 5 composite restoration subgingival and you have bleeding. How do you handle that right now? Well, I'm guessing you could use retraction cord. You're going to anesthetize the patient. You're going to put hemodent or something to get the bleeding to stop. The tissue becomes black and discolored. We put a composite in there that doesn't look right. It's stained. So the dental laser is a tool that will allow me easy access to visualize the situation and to treat the patients very efficiently. Decreased treatment time in many cases, as I've already mentioned. A good retraction will result in a very, very good impression. And we all know that an impression is the most important part that we can do, especially with our digital impression techniques that we're using today. You know, if there's any bleeding whatsoever, that our digital impression can be harmed to some degree. Patient comfort, tissue management, it's much better. It's a simple tool, better than a scalpel or electrosurge. Very minimal need for anesthetic. Topical anesthetic may be indicated, and our patients just have a tremendous result afterwards. Very minimal postoperative discomfort, even if we're doing a frenectomy or a more invasive procedure. It's just a wonderful tool. So again, to review, minimal bleeding, minimal postoperative discomfort for the patient, faster and more predictable healing. We don't see gingival recession. When you're doing your aesthetic dentistry, doctors, in the premaxilla, you want to know where that tissue is going to heal. If you're doing some tissue repositioning or some minor gingivectomies to establish better emergence profile. It's precise. It's like a Sharpie. We're used to working with a handpiece in our hand. We don't get tissue scarring, and it's very helpful in the treatment of periodontal disease for pocket reduction and reduction of the bacteria count, which allows us to get a much better periodontal result as opposed to some of the other common procedures that we use, like Arrestin or something like that. My results are very, very predictable, and I strongly believe that because of the time saving and the procedures that you're going to be doing, in a very short time, you're going to get your return on your investment, especially with what DenMat is attempting to do during these trying times for us. You can oftentimes, the hygienist can see a patient in hygiene and do their scaling or whatever. Oftentimes it's traumatic to the patient, traumatic to the tissue, but because we're using the laser, we can actually see those patients in the same day. And again, being in Detroit, as most of you know, it's a different mentality. Time is the most valuable asset our patients have, and the more dentistry we can do at one sitting and one appointment, we are much more appreciated by our patients. So here's our diode laser. You can see it can coagulate and cauterize. You get immediate hemostasis, very, very good healing. and reduce swelling. You can see patients directly from hygiene procedure to same-day restorative with no wait time. You can see the design. It's basically the size of a Sharpie. You'll get several glasses for the patient, for the doctor, and for this team member. You will get disposable tips that will allow us to do periodontal and our dental procedures. Scalpel, we all use a scalpel, opens blood vessels and nerve endings, and it hurts, especially if we incise into mucosal tissue. If we incise into mucosal tissue, we get prostaglandin and histamine release, and our patients are uncomfortable, they swell, they hurt. We don't see this complication when using the NV Pro 3 diode laser. Blood vessels spill blood into the surgical site, making it difficult to see, require suture. Nerve endings, as I said, spill histamine to the surgical site, causing inflammation and postoperative pain for the patient. Our laser, as I mentioned, coagulates the blood vessels, cauterizes the nerve endings, and sterilizes the wound edges. This coagulation allows us to work in a dry field, not having to do sutures. Digital radiographs, digital impressions are very easy because we have a bloodless field. By cauterizing nerve endings, you're stopping histamine release, reducing postoperative pain and inflammation, and eliminates the chance of infection. Electrosurge, I don't know how many of us still use electrosurge, but I'm amazed when I do my courses how many people raise their hand when I ask. I think it's old technology and really should be outdated in your practice, just for the medical complications, the cardiac implications and problems that you can create using electrosurge in the area, because you have to ground the patient. You can't use electrosurge around any metal. You can't use it around implants or crowns with any type of metal in it. You can't use it around our metal dental instruments. And oftentimes it'll cause swelling, postoperative pain, recession. It's just not predictable. The laser is photothermal, and you can use it around metal. We can use it around implants. We can use it in our endodontic treatment to sterilize areas. We can use it in treatment of failing and ailing implants to try to sterilize the site. You can use it around conventional crowns. And again, it'll be used in our periodontal treatment by our hygienists that we'll discuss in a little bit. So an electrosurge is very traumatic to the tissue. It will cut on average 500 to 1,000 cell layers thick. Our NV Pro 3 dental laser only goes 3 to 5 cell layers thick. So it's very, very non-invasive, very easy procedure. Whew, a lot of words there. Let's get into some of the clinical applications. The FDA has cleared the NV Pro 3 diode laser for cellular debridement of diseased fibrous tissue, gingivectomies, gingivoplasties, lesion removals, fibroma removals, tissue retraction or tissue troughing, aphthous ulcers, gingival hyperplasia, crown lengthening. We're talking mostly gingivectomy, minor. You have to be concerned with the biologic width and things like that, but it is a tool that is useful in our aesthetic dentistry. Frenectomies, especially frenectomies on young kids, where we can do these procedures without anesthesia for these young people. And it's a very non-invasive, very atraumatic procedure for our patients. And coagulation, as I mentioned, if you have a bleeding site, you have a class 5 and you traumatize the tissue, we can actually coagulate the area very, very well. I use it a lot in my hands for laser troughing or retraction. What's nice about, and we don't have a hands-on obviously, but we have presets, and I'm going to demonstrate all the presets, and then we can practice when we meet in one of our courses in the future. But you'll set it, it'll say laser troughing on the instrument. It'll preset to a power, a continuous mode. Initiating the tip means that we will darken the tip using either a cork, or more frequently I will use a blue occlusal paper, and we will darken the tip to focus the energy. That's called an initiated laser tip. Class 5 restorations, gingival recontouring, frenectomies, implant recovery. Doctors, you know, I do a lot of implants, and you out there hopefully are doing surgical procedures. If not, we certainly need to train you on that. But we oftentimes will bury the implants and we have to uncover them. And I challenge you, how do you uncover those implants in your practice right now? Well, I would say most of us will use a scalpel. We'll use a high-speed burr. We will use what's called a tissue punch or a circular blade to remove the tissue. Those are all traumatic, and for those of you who have done it, you know that when we incise the tissue, even the epithelium, we will get bleeding. Now, if we have bleeding, it can affect the way the tissue is going to heal, and it can affect our final impression. If we don't have a crisp, clean impression, the laboratory's hands are tied to some degree, and we won't get the clinical results that we normally can do. Destruction of a lesion, herpetic lesions and aphthous ulcers. This is a wonderful treatment. I don't know if any of you, my lecture, I like to say, any of you out here have herpes? Anybody who have cold sores, if you have a family member, they can be miserable for a week to 10 days. They hurt, they burn, it affects your social life, it's embarrassing, you can't kiss, although I guess we're all socially distant at this point, we have to stay 6 feet apart anyways, but it's a tool that our patients have been very, very responsive to the point where if they feel a cold sore coming on, they will come to the office and ask to have us lase the area to eliminate it nearly immediately without any complications. Our periodontal or hygiene applications, laser-assisted periodontal therapy can be used in adjunct to traditional scaling and root planing. The laser selectively targets only darker necrotic tissue and leaves healthy tissue alone, allowing for better healing and results. The dental hygienist can also perform other procedures depending on state laws. So I know we're from all over the country here, but you do need to talk to the team at DenMat to determine if your state will allow your hygienist to use this dental laser as a treatment tool. For those states that don't allow it, that's okay, because your hygienist can prepare the patient, and you as the dentist can come in, everything's set up and ready to go, and you can do these procedures in the hygiene operatory in a very, very short amount of time, which is a very, very nice revenue stream, which is important. But most importantly, it's a positive reinforcement to your patients, and the results are so positive. The health of the tissue becomes so incredible in our hands that the patients, again, are very, very appreciative of what we're able to do. We're treating our patients the right way. Again, presets on our NV Pro 3 dental laser, laser bacterial reduction, decreasing the bacterial count, sulcular debridement, helping to soften calculus tissue or to remove fibrotic tissue in a deep pocket area. Doctors, what about sensitive teeth? We all have those, and the hygienists are really great about finding those individual areas in our mouth. How do you handle a sensitive area? The tissue resorbs as we get older, the root structure, the cementum is exposed, hot, cold. I'm assuming we use a lot of different takes. We can paint something on it, we can put a paint of varnish on it, we can put, there's different materials that we can use. How about if we used our dental laser? You could use fluoride, but those things don't last very long. If we use this diode laser, we can get nearly immediate desensitization of a root, and it's amazing. I can use this, I can put an ice cube on that area, and the patients are just so positively reinforced on what we're able to accomplish using this very simple tool. Presets at the NV Pro 3, again, I love it. I know we have a lot of tools and toys in our practice, and I'm a big believer, for those of you who heard me before, is I love new technology. I think it's incredible. It makes us more efficient, proficient. But if you're going to purchase something that has some cost to it, you have to be able to use it every day. It has to be financially rewarding to you. But we use this instrument, and oftentimes we don't use it a lot. We forget how to use it, and we rely on our staff. This is probably the simplest laser that I've ever used, and I've used several over the years. The presets are wonderful. once you get the hands-on, and you can go to drkosinski.com, our education website, or you can go to the DenMat website. We do have video demonstrations of how to use this. And as you purchase this tonight, I would recommend that you watch our instructional videos, again, drkosinski.com, or to the DenMat site, and it goes through step by step on how to use this. So you can become very, very proficient using this instrument in your practice in a very short amount of time. And again, some charts, all the different procedures that I use the diode laser for in my practice. So let's get into clinical. Laser troughing, okay? When we retract, when we prepare a tooth, we retract, what is most important to us is that we get predictable margins. We want our prosthetic design, our crown and bridge, our bridges, our implant crowns to be precise to the soft tissue. We want emergence profile, we want smile design. We don't want tissue recession. We have to predict that we don't get tissue recession. We don't want bleeding. We don't want the patient to have discomfort. Docs, you have a patient that has a root canal. We can prepare those teeth at or slightly subgingival and retract using the diode laser to trough or retract around the area without any anesthetic at all. So it becomes a faster procedure because we don't have to wait for the retraction to occur, which allows us to get very, very precise impressions in a cost-saving amount of time. And that final impression is critical to the final result that we're going to be able to provide our patients. So here's just a clinical case where we were able to, and there's a learning curve with this, Lauren. There is a learning curve. Again, pigmentation of the tissue determines the setting that we have, and you can see in the most anterior area there, I do have a little bit of charring there, because that tissue is very pink. If it were darker, I could turn the power down. If it's lighter, I turn the power up. But when we start seeing that little charring, what we have to do, and it's a simple up or down button to turn that power level down so that we don't char the tissue. And we learn that over time. You'll see my later cases, I'm a little bit better at it. Versus a typical retraction, we all know how difficult it is to retract sometimes. When there's not a deep sulcus, it can be really, really hard and time consuming. We get frustrated and we don't get the impressions that the patient deserves and that we really want. So again, precise impressions, faster, predictable margins, and we can oftentimes not use anesthetic. When we use a retraction cord, takes time, can result in some discomfort with the patient and bleeding. Now, DenMat, as I mentioned earlier, is a company on the move, and they really care about us dentists. They want us to be very, very successful, and they've created, they have a wonderful dental laboratory. The veneers were basically created by DenMat way back when I was a young man. So it's time for you to at least evaluate and find if you like this company. They do some wonderful work. Here we have a crown that we have some recurrent decay that we're going to remove. And so I simply remove the crown. If it's a root canal treated tooth, I can clean up the margins a little bit. Can you see the little headlight on my head? It's called a firefly. It's another great tool, doctors, to help us to visualize the case. It's a headband, a very high intensity bulb in it, which allows me to have very, very good visualization of the area. So that's something else you may want to talk to your DenMat rep about. It's called a firefly. I really like it a lot. So we take our laser, and again, we're not going to go through the video demonstrations here, but preset, laser troughing, we'll press enter again. It'll give me a preset on it. I'm going to initiate the tip by using our blue occlusal paper. And what that's doing is it's just charring the tip. Remember, the laser only cuts at the tip. It's not cutting on the side. It only works on the tip. So this is focusing the energy to the tip, which allows for efficient incision. And I'm simply going around the tooth very slowly. This is not Star Wars type of laser. but I'm going between the tooth, the margin, and the sulcus, and I'm going very slow. And what I will do is create a trough, allowing me to take an impression. Now, DenMat also has some very fine impression materials that you may want to have. Jennifer, I don't know if you're going to have specials for the people listening today, but it's a very, very fine, inexpensive material. The tissue heals beautifully, and the laboratory is doing some very, very fine Emax and zirconia crowns for me, allowing me to have very, very nice, high quality dentistry for our patients at a reasonable cost. Doctors, dentistry is getting very expensive. We don't know where things are going to go when we get back to work, but if you can provide the patient high quality at a fair price, you will be busy. And working with the team at DenMat allows me to have the highest quality products and materials that make me proficient and efficient, and I can pass on savings to the patient, and the patients are very, very responsive to that. And again, we can see our traditional dentistry done over many, many years versus our new zirconia crowns, which the tissue responds to very, very nicely. So with laser troughing, what we want to do is initiate the tip or focus the energy. The laser is set at 1 watt. There's nothing to think about, doctors. They're preset settings. We're going to insert the tip approximately 1 millimeter below the hard tissue margin. The laser tip is placed parallel to the long axis of the tooth, between the tooth and the sulcus, and we're going to just slowly continue circumferentially around the tooth or until the areas needed to be exposed and the margins and hemostasis is achieved. I know many of my friends, a shout out to Dr. Tilley down in Pensacola. I know that she's incorporated the diode laser into her practice very, very effectively. We're going to just simply wipe the tissue gently with hydrogen peroxide on a simple Q-tip or a cotton pellet to remove any discolored tissue and visualize the margins better. You'll be able to see the margins effectively, and then you can take your final impression, which will be very precise and accurate. So I'm just troughing around the tooth and making our impression. We want to use the optimum power setting for the patient's tissue and pigmentation. Again, to reinforce what I said, this laser works on pigmentation or hemoglobin. So some of the lasers you have to constantly irrigate with water. You do not have to work with this. So if you have a darkly pigmented epithelium, the laser is going to work more efficiently, and you may want to decrease your power level by simply turning it up or down. We're going to blow air around the tissue to hold a volume evacuator near the laser tip, because you are going to you're thermo vaporizing the tissue, and you don't want the patient to smell that. Use the appropriate power setting, light brush strokes. Remember, the laser is only efficient at the tip. And if the patient does complain about recession or a discomfort, then the power setting is too high. So if you're getting charring, it's important that you realize that, set the setting down. If the patient has some discomfort, if they're feeling the heat generated, you can turn that power down and the patient will not feel that discomfort, and we will eliminate recession. So what you prepare, you can feel very, very confident that that is the results you're going to end up with. So again, a tooth that we prepare, and the laboratory is able to fabricate a really nice zirconia final crown. Again, challenging situations in the posterior maxilla, recurrent decay. We really have to be aggressive in our preparation. We know that retracting this site can be challenging and difficult for us, even on our best day. We can laser trough, and again, the laboratory will fabricate a nice zirconia crown. Again, one more case where we have same patient, contralateral areas where we have old crowns that we need to remove. We're going to remove those crowns, prepare the tooth, and I'm using the laser on one end to trough trying to be a little bit atraumatic, seeing the margins versus retraction cord. You can clearly see the margins on the laser area. Now remember, the nerve endings are cauterized here. The patients aren't going to experience a lot of discomfort here in this situation. We know a challenging situation, you can see how the blood wants to coagulate when we retract, and it's very time consuming. We'll use the DenMat light body and heavy body material, and our results are nearly the same. You know, our conventional techniques work fine, but again, for efficiency, I think the diode laser is going to save you a lot of time and anxiety in your final impressions. Another great tool, I'm going to run through this rather quickly, is something called LumiSmile, and I really want you to investigate this through DenMat. This I won't go through the whole story that I would normally do in my course, but this young lady, very, very attractive young lady, obviously has some serious issues, large restorations, composite restorations, and wanted a nice smile. We decided to start with the maxillary teeth. How do you explain to the patient what they're going to look like? Nobody's answering me, so I'm going to answer myself. That was supposed to be a joke. Normally, we would take an impression, we would pour it up, we would send it to the lab. The laboratory would do a diagnostic wax up of X number of dollars per unit, $20, $30 a unit. We would bring the patient back. Your chair time is very, very valuable in your practice. And you would show the patient a before model and a diagnostic wax up model, and hope that the patient has any inkling of what we're talking about. Well, DenMat has worked out a system called LumiSmile, and it's an app on your phone. And what I will simply do is I will take a photograph of the patient, and I will send this information to DenMat, and within, I'm going to say on average, about 15 minutes, you will get a virtual design of what could be created, a virtual design of what could be created, sent to your phone, your email, the patient's phone, or the patient's email. Now, I'm going to tell you the response has been incredible here. What do the patients do? They get excited, and they immediately Instagram or text or whatever to their family and friends, and it is a great motivational tool to try to help your patients understand what's possible. So here we're simply taking our photograph, and within 15 minutes, this was the virtual design that the team at DenMat provided me. She was excited and ready to go. So we prepared the teeth. The teeth were very soft, and we laser troughed. We did the anteriors first, and then I did the bicuspids at a later date. But we troughed the tissue, and the laboratory, we used the DenMat impression material to get some accurate impressions. The laboratory fabricated some wonderful porcelain crowns for our young patient, and we also did the bicuspids, and we're able to give this patient a really wonderful smile to the point where she's ready to do the lower area. She did get pregnant again, so we're just kind of waiting. And now with COVID-19, we're just going to have to wait and see when we're able to treat her. But high quality dentistry, time saving doctors. This is important for your practice. And again, I know it's the second time I said it. Efficiency in your practice, chair time is very valuable to you. And being able to demonstrate and instruct and educate your patients about what you're able to provide them is a big asset to them. And a before and after smile. Another one, a young lady came in. She wanted, 8 veneers, and she was young, very young. And what I said is, let's just do some contouring, some whitening, and let's just take care of the peg laterals. And if you're not happy, then we can go back and do the other ones. So we prepare those teeth slightly. and we did the Luma Smile. So within 15 minutes, I could show her, and she goes, oh, yeah, maybe I don't need to do all of those, all my anterior teeth. So again, initiating the tip on our laser, retracting, and on the other side, say I use my hydrogen peroxide to kind of clean out the area, and on the other side, I use our traditional retraction cord. You've all seen this a million times. You know what the results are. Bleeding, no bleeding with our laser area. We take our impression. The results are basically the same. In the laboratory, fabricated some nice porcelain veneers, and we're able to provide our patient a nice, adequate smile without over-treating her before and after. Gingivectomies, we can do contouring of our tissue. This is minor gingivectomy, minor procedures to kind of contour soft tissue to create symmetry. And again, presets make it very easy. Here's, we're doing an implant, and we just wanted to contour the adjacent central incisor to allow us to get better profile. And we'll show a quick video here how simple the procedure is. So presets. And this patient just wanted, she felt that there was too much tissue. And so we just did some very, very simple contouring for her to try to lengthen the teeth. And you can see it's not a fast process. And I'm just doing some contouring, being aware of the biologic width. And we actually brought this patient back a couple times. Again, there's limited amount that we can actually accomplish. But when we finished, I think the patient was very, very satisfied with a very, very essentially non-invasive procedure for her. And just take your time. And again, in the video demonstrations that we have on drkosinski.com or from DenMat education areas, we'll demonstrate this in great detail of how you preset. Or please come to one of our classes. I'd love to see you and review this with you. And DenMat has some other outstanding courses like photography courses and things like that that are really, really nice. And just clean the area. Now, no anesthetic here, no anesthetic, and the patient doesn't experience a lot of very minimal discomfort, actually. It's pretty amazing what we're able to do with our NV Pro 3 diode laser. Immediately following treatment. I know it looks a little angry, but it's not uncomfortable for the patient whatsoever. Patient came back in 2 weeks. And we did some little touch-ups at that point. Frenectomies are very bloody, sutures, time-consuming, requires injections. Laser frenectomy, no bleeding, no discomfort. Most of the time, I don't even need any anesthesia whatsoever. So I'm going to move a little bit quicker here. Implant recovery, again, we can use it around metal components, doesn't spark, doesn't heat the implant, it's not going to damage it at all. But again, as I mentioned before, how do you retrieve these implants that are buried? You can use a punch, you can use a scalpel, or we can use our laser to remove the soft tissue with little bleeding, which will allow us to get a very nice impression. I'm going to pass through this just so that we can get some of the other information. Again, implant recovery, preset, initiate the tip, no anesthesia is needed, and I'm able to uncover the cover screw, make our impression, no postoperative bleeding, no postoperative discomfort. We get nice tissue healing. And again, we have a couple implants here. We know where the implant is. I will use the laser to uncover without anesthetic. Remove the cover screw, put a healing abutment. Now I want you to look at this photograph carefully. I'm going to slow down a little bit. Here we put a taller healing abutment, which penetrates through the soft tissue, which will allow the tissue to heal, versus our more conventional technique of a tissue punch, where we're using a circular blade. And look at the amount of bleeding that we have. We did a healing abutment, but look what happens 1 week post-op. The tissue where we used the laser did not shrink at all, where we did get some recession in the posterior implant healing abutment where we had incised. And this is a very important fact to make. Maybe not so critical with a denture patient or the posterior maxillary mandible, but this is critical in the aesthetic zone, in the maxillary anterior region. Hey, just today, DenMat said that to help the profession, they are now providing hand sanitizers. So you may want to get on the phone and order if you're having a hard time finding hand sanitizers. 80% ethyl alcohol. Most of the hand sanitizers that I've seen are 70%, and it's made in California. So you may want to contact them. I appreciate it, Jen and the team at DenMat for helping the profession in things that are very, very challenging and a little bit traumatic for us to use. Biostimulation. We don't initiate the tip because we're not going to cut, and we use this to eliminate aphthous ulcers and herpetic lesions. We call this low-level laser dentistry. It increases circulation, collagen formation, osteoblastic activity, and fibroblastic activity. And again, it's spreading the energy because we're not focusing the tip. We also use a non-initiated tip for laser bacterial reduction, as well as what I mentioned before, aphthous ulcers or canker sores or herpetic lesions. Presets. Here we have an aphthous ulcer. We're not touching the lesion, and I'm simply going in a circular motion around the lesion. I'll do it 3 times. It takes about a minute, maybe a minute and a half. 1 week post-op, it's gone. Herpetic lesions, again, cold sores. It's best to get them when the patient first is responding to that tingle. Again, presets, we're not touching the lesion. We're simply moving the, biostimulating the area, not touching it. We're about 1 millimeter away. Immediately following treatment, it doesn't look very much different. The patients may feel a little tingle or a little heat, but no pain. Again, patients come back a week later. The experience that our patients tell me is they're getting an immediate response. The next day, it feels better. So they're not going through the trauma of a week of pain and discomfort. Another pretty invasive herpetic lesion without anesthesia, just kind of going around. 1 week post-op, the lesion is essentially gone. So again, this is a very good marketing tool for you. Very ugly lesion. 1 week post-op. So very routine. Angular cheilitis here in Michigan in the winter, you know, where we have overclosure or we have saliva. You know, that's bacteria. Again, we will biostimulate the area and we will get a response. Mucoseal, again, a nice instrument. Here we're going to initiate the tip and I'm going to incise it or vaporize it. 1 week post-op, it's gone. Tongue lesions, very interesting. Is that a bite mark or whatever? We decided to use our biostimulation. 1 week post-op, amazing. Patients from a burning, hurting sensation on the tongue to 1 week, 4 days post-op to basically gone with no discomfort. Very, very strong marketing strategy for your patients. Finally, let's go talk about periodontal very briefly. Scaling and root planing we use Arrestin antibiotic treatment. Periodontist, flat procedures, bloody, expensive. We can use our laser bacterial reduction with a non-initiated tip, and we can eliminate pockets using this. Here we have a deep pocket. We can scale, and post-operatively, 1 or 2 weeks post-operatively, we can basically take a 5 or 6 millimeter pocket with our perio probe and reduce it to 2 or 3 millimeters. Very, very consistently, without a lot of discomfort for our patients. Reduces the bacteria in the pockets, reduces the risk of bacteria entering the blood. No anesthetic is required. Improves the effectiveness of our laser-assisted periodontal therapy and can even soften calculus deposits. Again, bleeding on probing, the hygienist will, or I will, use a non-initiated tip, and 2 or 3 weeks post-operatively, we can see no bleeding on probing and a pocket reduction. Again, I don't want to go too much at the end of this program here because I know we want to get into questions. We can keep it at a continuous mode, which means the power setting is halved, or in the pulse mode, we will increase the setting. Higher settings is for more advanced periods. Lower setting is chosen if we just have simple gingivitis. Non-initiated tips. If you are doing removing fibrous tissue from a pocket, then the tip may initiate itself. And you have to understand the rules in your particular state, whether or not a periodontist can use an initiated tip or not. And again, I'm going to refer you back to DenMat to help you in that determination. So again, bleeding on probing, simple laser bacterial reduction, eliminating pockets. And we do this routinely, time after time, around brackets for young people. Again, without anesthesia, getting a healthier situation for our patients. It selectively removes the disease epithelium, doesn't harm healthy tissue, allows the healthy tissue to regenerate. We can consistently reduce a 6 millimeter pockets to 2 to 3 millimeters without any medicaments. An interesting case, an old blade implant where I started dentistry, inflamed, an older patient. Most of us would take that blade implant out, bleeding on probing. I simply used my laser. 4 weeks post-op, we eliminated the pockets. We eliminated the bleeding on probing. Just remarkable. And finally, desensitization. We talked about that earlier. I'm going to run through this a little bit quicker, Lauren. But we can seal the dentin tubules. And what we will do is we'll simply paint a varnish on that area and then biostimulate. We're not actually touching the tooth, and we will get immediate response. Here are the codes if you want to take a quick photograph and what we can charge for these procedures. I'll hold this up for a few seconds so you can get your phones out, or you can, this can be provided. So again, I'm going a little bit over here. I apologize, Lauren. But 12 presets, easy to transport from room to room. A simple procedure, highly accepted by our patients, great clinical results. It's wireless, it's very non-invasive, it looks like a Sharpie to the patient, looks very high-tech to our patients. You can move it from operatory to operatory. We were sharing it with our hygienist until it got to the point where I had to purchase one for her because she uses it consistently. Very innovative product. Disposable tips, and I'm sure that the team at DenMat has a special with those disposable tips.